just to say this is the first time that we've actually had this this particular item on the annual general meeting day, and you will have heard from Helen of the exciting policies that have been enacted this year. First up, I'd like to invite Dame Anne Johnson, who's chair of our Health of the Public 2040 working group, to tell us about that particular project. Anne.
Good afternoon, everybody. I'm delighted to be able to tell you about this project. It was actually just launched, I think it's about 10 days ago. And I can also see that some members of the, I can put my glasses on, I can see that there are actually some members of the working group in the room. So it's very nice to be able to tell you about this project today. The first thing I want to say is that you'll see that the title of the project is Health of the Public 2040 and not Public Health. And we don't want to have the discussion about what the difference is, but what I'm trying to signal to you here is that we are trying to take a very broad view of the determinants of the health of the public in the future. And therefore we are considering the social, biological, economic, environmental and political factors which may influence health in the future, and really looking beyond the formal discipline of public health, and to try and take a real forward look. And that's the purpose of entitling it Health of the Public in 2040. We don't want to be, in a sense, hidebound by current structures, but to start from the position of looking forward to what the challenges will be ahead of us in terms of a changing population, an aging population, a growing population, environmental change, economic change, all of which are likely to influence our own futures and the futures of the next generation. So in taking that forward, we aim, first of all, to identify the main health challenges in the UK and that the UK population will face and the opportunities to address them, and to develop, therefore, a vision for the health of the UK in 2040. Underpinning this, then, is that if we have a vision of where we might be in 2040 and what the challenges might be, we can then look back to now to consider what the multidisciplinary research base will be the one that we need to have an effective both evidence base and the right kind of interventions to improve the health of the public with that future vision. It goes without saying that I think all of us would recognise looking forward that we may need very different skills to be competent for that future. And the sort of skills you can consider are, for example, the very broad base of managing big data, the broad base of informatics, not just bioinformatics, but health informatics, the whole new information revolution, the Internet of Things, and how we will actually understand and communicate in 2040. Not to mention how those of us who are in clinical specialties will practice clinical medicine. And I think we only need to think about citizen science to think we may be, the nature of a medical consultation may be a very different thing 25 years hence, and that we may be thinking as much about prevention and integrated care, or at least we're going to have to be to afford it, as we will be the acute problems of the patient in front of us. So we do need a highly skilled research workforce in population health sciences to address that in the future. And most of all, we need to also make sure that we have the right links between evidence, policy development, service delivery. I think now, and since I qualified some time ago, there is a very different relationship between evidence and clinical practice, in that I think evidence-based medicine has, or the topic of evidence-based clinical practice has totally changed. I'm not sure we have yet, we could debate that amongst those of us in population sciences in the room, whether we have really achieved that in the many disciplines that contribute to policy and practice in population health. And that is part, I think, of what we have got to improve. I should also say that the whole project is, and it's on the bottom of the slide, I want particularly to thank MRC and the Wellcome Trust for their funding and insight into taking this forward, as both of those groups and indeed have a major role in funding this area of research. So here, of course, is shortened list of our terms of reference, and I don't suggest you read it all. It's all available on the website. But I want to really say that we do want to bring all relevant areas of science into this, and I do include in there social sciences, political sciences, and economic science, and of course new technologies. Bringing together disciplines, that's at the heart of it. And we're going to work by first considering the challenges in 2040, and then work back from there to say, if we want to be in this position in 2040, who do we need to be training? What are the skills we need to develop? Now, that actually means that the people we train now, from 2015 onward, are the disciplines that are going to be, the scientists we train now, are those who are going to be leaders in 2040. And there are probably many specialties we can think of, particularly, I think, in computing science, big data, and many of the other sciences I've mentioned, that we're going to have to bring to bear and train now to be fit for purpose going forward, and communication strategies is another very big area. And to do that, therefore, we need to think about the skills base and the structures that should be in place to make sure we can effectively interface between science, practice, and policy. What's in and what's out? Well, we want to include the different types of research, the disciplines, methods, and mechanisms which can support us in decisions about interventions. We don't, however, expect to be commenting on specific interventions like alcohol and smoking policy. We're talking about the generality of the approach we should take going forward. We want to think about ideal scenarios for 2040, and we want to compare those ideal scenarios with the current public health of the public structures in the UK to think about what we should put in place that is different from now. But we really don't, although we're going to be drawing out a landscape of what currently exists, we're not going to start in the usual position of assessing the strengths and weaknesses of the current system, because I think that's something we could get totally bogged down in if we don't look forward to what we want for the future. We will take a UK focus, but as many of you in this room know, UK science and health of the public is not just about the UK. We have many, many collaborations abroad, and what happens in global health, and indeed the latest buzzword, which is planetary health and sustainability, will absolutely affect our strategy for the future. So while we're talking about systems in the UK, we will be thinking much more broadly about how that relates to our international place in science of the health of the public. We launched, as I said, on the 24th of November. We had a fantastic multidisciplinary workshop, and they really weren't, as I said at the start of the meeting, the usual suspects. Some of the usual suspects are in the room, but there were many people from a huge range of disciplines. And I had a series, and the Academy received some really wonderful emails. The greatest thing was everybody said, I met a lot of people I'd never met before from disciplines I'd never heard about, and they made me think. And I think that really is at the heart of this project. We will have, we thought actually that everybody sat down and thought about the future, and they really enjoyed themselves. We were putting out a call for ideas and evidence. I don't want to, somebody said we can't have evidence about the future, which we can discuss, but so it's a call for ideas and evidence. And both the workshop and that evidence or ideas will be used to develop the practical recommendations for the future. Or as I say, we're using a futures look, horizon scanning techniques, and we'll take about 18 months to complete. But I was challenged by somebody very senior in medicine to say we should do it rather quicker. So we'll see how we get on. But I expect it will take us 18 months. John's looking at me very suspiciously. So that's where we are. Now, we want this, obviously, to go out and to aim this at policymakers, funders, researchers, providers, and the public. But I just wanted to tell you what's happened in the 10 days since, or in the preparation phase, and in the 10 days since we launched. We have run, I think, as already been mentioned by Helen, that we have carried out some public engagement events. And this is, as has been pointed out by one of our members, a totally, absolutely non-random sample of individuals who took place in some focus groups and as part of a science film festival in Birmingham. And it's interesting to see the topics that come up. First of all, in the middle, you can see that people clearly recognise that the world is changing, we're living longer, we're dying of different things. On your left-hand side, on the left-hand side of the screen, I'm very interested to see the extent to which people discuss the role of legislation in behaviour change. Should vaccination be maintained mandatory? Should we ban fast food? What is the role of legislation in health policy? We're often very driven by the idea of individual behaviour change. The evidence is that actually very often it's social change and legislation which may change behaviour. More should be spent on prevention, they said. We wanted in the top right-hand corner that something about how people will use the internet and use home devices for testing for a range of infections, blood pressure, blood sugar and anything else we might measure. And that we're going to begin to see much more remote practice of both prevention activities and indeed clinical activities. And we need to embrace a very different kind of way of interacting with the public in how people learn and understand their health. So those are the things that the public said. Now, all of those have resonance, I think, for some of us in population health. But there are some things on that list that people in the specialty thought about, which had absolutely no resonance with the public. Perhaps unsurprisingly, when people think about health, they generally address you about the health service. And so the Lancet has launched, and I'm very grateful to Richard Horton, I don't think it's here, but he has launched on the Lancet website the challenge of writing 250 words about the health of the public in 2040. And it's marvellous to see the medical students writing in, and this is a medical student from the University of Southampton. I'm sure you've already read it. But it's a rather dystopic future that they have in mind, that generation 1960, who didn't endure the post-war austerity of the baby boomers, would be in a very different situation. And when some of us in the room who might be 80 in 2040, it seems we'll be an ethnically and economically and socially diverse group with a range of population problems, and this terrible idea of a young population of hedonistic and geographically distant children. So you may want to take out your insurance now. But I think that this is the main point about this is that I think this younger generation of health population health researchers with whom we really want to engage probably see the future in different ways than some of us others might do today. The top quote here from somebody in Ahmad-Dalan University clearly recognises the multidisciplinary nature of population health, government, business, law, art, even faith taking part. And this last quote, Martin O'Flaherty says, "I am the last one in 2040, the last public health practitioner. I live in a city with harsh winters, savage hurricanes. I supplement my wages by wearing smart contact lenses that paid me pennies for watching adverts." I didn't understand that, but there we are. I think I'm getting there. And we saw this coming in 2015. This is what we're trying to do. We've lost the battle to tame corporations. Now I hope to survive the winter. I am the last public health practitioner. I am a legend. So there we are. I hope it isn't like that. But I'm going to give the last word to Richard Horton, who said, and this is the challenge he's written on the website, public health needs a renaissance. And not health of the public, I note. But as the world moves into an era of sustainable development, UK public health should not miss this opportunity to rewrite the contract between health and society. So to the working group and all of you in the room, here's the working group, that's the challenge. Well, we'll see if we can meet it. Thank you.
So no small challenge then.
Yes.
We've got time for a couple of brief questions. Chris.
And that was a super outline. One of the things that you didn't mention was in this country we appear to have a divorce. That was a super outline. In this country we seem to have had a divorce between public health and mainstream medicine. Do you think they could get remarried?
I think that's a really important topic, and I think it's one that we must address. I mean, you can see from all the debate that's going on now and recent reports that everybody is recognising that the kind of population problems we're going to face, we are not going to be able to meet the problems of my own generation when we get older through the current systems of medicine we practice. We're going to have a much more seamless health and social care. But that's only part of the story. I personally, and not everybody would agree with me, and maybe the working group don't agree with me, I personally think we have got to bring population sciences much closer to clinical medicine, as well as allowing population health sciences to embrace a whole range of other disciplines. I would like to see this population view of the world much more closely embedded in the way our medical students learn and the way they think. I'm really encouraged that the medical students have been the first to write in, actually, on this Lancet challenge. So while I think John has said to me all along, don't boil the world, I have him sort of sitting on my shoulder because this is such a huge challenge. But I think on the one hand, we need to bring a new vision and a new set of disciplines into what we might call an institute or school of population health, bring those disciplines in, but at the same time, bring mainstream clinical practice to understand that population view. Otherwise, we simply can't afford it, and it's not what the population will either need or want.
Thank you very much. Keith.
Yes, splendid talk. Just want to follow on that theme. The separation, of course, actually happens within public health. The separation of epidemiology and public health, which seems extraordinary, but it's a feature that many people who are practicing public health actually have very little knowledge of epidemiology, or people who want a career in epidemiology have a very hard time getting into a clinical recognition.
Well, I mean, I regard epidemiology as still one of the basic sciences of public health practice, but you're absolutely right. And I think we clearly have seen, ever since I've been in the subject, innumerable reorganisations, and we have just had another one. Many of those in public health practice are operating at a level of population which is very small, and yet they're trying to apply generalisable evidence in very small populations, and we just don't have the capacity to do that or the right structures to do it. So in the way that I think activity within actually the academy has managed to bring academic medicine closer to clinical practice, I think we need to bring public health, let's call it population health sciences, in all its transmogrifications, in much closer to that kind of practice. But I also think that means that in medicine, and I do not restrict this to medicine, but the College of Physicians, the Faculty of Public Health, has got to recognise their role in that. And I would say that there are many, many different careers in population health sciences. I see a lot of people who are College of Physicians trained, they might be a cardiologist, who want to go into the population science of heart disease. I see many people who want to go into clinical trials, which I regard as a population science, because there are disciplines there, and yet we don't have the training tracks to do that. So again, we ought to have training tracks. We could see population health sciences just as where you can see clinical medicine as being divided into, cardiology, neurology, pediatrics. You could equally see population scientists as having to have specialist tracks through it into a common training program, which could be for both clinicians and non-clinicians. One doesn't want to homogenise it too much, but there's a great opportunity. Very clear.
And thank you very much. I'm afraid we have to move on to keep to timetable. And our next speaker is Professor Anne Ridley, who's chairing our Team Science Working Group. Anne.
Okay, thank you. Thank you very much. So before I start, I should say what I think team science is, or at least what the team of people that I work with think team science is. So before we decided to work on team science, we had to say what team science is, and it's two things. So you can think of interdisciplinary teams. That would be people, for example, working on PET imaging. You need physicists who improve the machines for the PET machines. You need biomedical sciences to say we need to target this molecule, and you need chemists to make the molecules to target. And so those kind of teams are really important. Team science is also very large teams. And this could be clinicians and researchers who all consider themselves biomedical researchers, identifying new mutations in rare cancers. So you need lots of people who are donating samples that they've collected over many years in order to find a mutation that is in a rare cancer, where you would need lots of groups to be working together. So we've taken on both of these as part of our Team Science working group. So why Team Science? Why is it important to think about it now? Well, in the past, and now even, we have an independent PI culture, where it's always one person who's running a group, which they might call a team, or their group, but they get all the kudos for it. They get to be the last author on the papers, and they go to give the seminars, and they get the grants. So like this guy here. However, team science is increasingly the norm. This is not, it's something that's changing over time. So now you can have huge teams working together to discuss, do things as I've said. I mean, CERN is probably the biggest team out, and you have 3,000 people contributing to one paper. So, and everybody gets acknowledged for their contribution, and they need to reach a threshold to get into this paper, but nevertheless, they've all made a very valid contribution. But the concern is that if you're working in a team, that you might not get recognition for your very important contribution to that team in terms of your position on papers or your recognition for your very valuable work that you're doing. You might always be a mid-author, but you're actually the statistician, and that paper couldn't get published without you. So we're taking proactive policy work looking forward to what it's going to be increasingly like. By 2040, we'll all be in teams, big teams. So we want to look at the roles of individuals in the team and make sure that they're recognised and rewarded for their contributions, particularly young researchers, because being the Careers Committee, that's what we're most interested in, is promoting the careers of these young researchers who might be not properly acknowledged for their contributions to the team. So we need to understand, and this is what we're doing through the Team Science Working Group, we need to understand and address the current disincentives and disadvantages of participating in team science so that we can improve and encourage people to participate in teams. So here's our working group. It's formed in part from the Careers Committee and from experts outside who are providing unique contributions because of their knowledge of team science. So this is me. Philippa Saunders is on the committee, and so is David and Mark Bass and Amy Fuchs. Now, importantly, we have two young career development fellows, Mark Bass and Amy Fuchs. She's a clinician and he's a biomedical researcher, who are providing the perspective of the position of working in teams as young researchers, and that's really important for our working group. In addition, we have added new people. So Ellie Zeghini is actually from the Sanger Centre, and she is completely the norm to work in huge teams there. And so she's providing the amazing perspective of what it is to work in these huge teams. John Fisher is Pro-Vice Chancellor of the University of Leeds, and he's really providing the employer's perspective in terms of what are the universities going to do to help with this. And Buzz Baum, who's on our Careers Committee, is really the interdisciplinary side, so he works with mathematicians and physicists in teams. Okay, so what is the working group doing? Well, at the moment, we're collecting evidence from a wide variety of sources, which I'm going to tell you about. So we're collecting and analysing the written evidence, we'll collect and analyse oral evidence, we're going to develop recommendations and produce and launch a report. So the kind of evidence we're looking for is from a broad spectrum of people, and there's good reasons for this. We want to know what researchers think. We want to know what the people out there working in teams think. Do they like working in big teams, or what are their concerns about working in big teams? Do they get lost, or do they feel that they're valued for their contributions? We're looking at how publishers recognize team effort, so how they acknowledge each author for their contributions. And there's some very interesting work going on with publishers at the moment that we found out that's really forward thinking in terms of how this can be done. So having every author given a drop-down list that you choose from for what they've contributed to the paper, rather than just having this random acknowledgement at the end. We're very interested in what funders are doing, how they fund big teams, and how they recognise people who maybe have always worked in big teams when they apply for a grant. How do you acknowledge that they've made an important contribution? And employers, how do employers view people when they're promoting them in terms of big teams? And of course, the ref, which has been on our minds for years now, but particularly this year, and how they've looked at team contributions. Okay, so the project was actually officially launched on the 15th of September, but actually there was a lot of work before that where first of all, the Careers Committee came up with the idea of the team science, and then we had a lot of work beforehand to identify key stakeholders we wanted to address. We made a video, which I didn't want to show because it took 3.5 minutes, and I thought it was a bit long for a short presentation, but you're welcome to see it on the website. You'd be very glad to hear I'm not playing the viola. I was filmed playing the viola, but I managed to get them to cut that. So, and then, we've been getting written evidence, and that's finished now, although we're still welcoming informal written evidence from other sources. We're planning oral evidence meetings when we're going to get people to come to the team and listen to the oral evidence. We're going to have research focus groups where we actually ask researchers to come and discuss the problems they have. And we're going to run a workshop in September and then publish the report next in 2016. So Richard Mallam is the member of the Secretariat who's been valiantly supporting this from the beginning, and he's very keen to get engagement from anyone. So you're all very welcome to put your comments to him on an email or talk to him. He's right over there. Okay, so the example of stakeholders who've already submitted their evidence, written evidence, is researchers. So we've had a lot of researchers from very different, all the way from PhD students to professors, submitting their evidence about, and from multiple places and institutions. We've had funders coming in, and not just national in the UK, but also from abroad, and the Human Frontier Science Programme, which is totally interdisciplinary, that's its goal. And we've also had employers, so a variety of universities, the Sanger Centre and Institute of Cancer Research. We've had a lot of engagement with publishers, and in fact, the publishers are really interested in how we acknowledge large teams, and they're working on how to do this, as well as how to acknowledge all the funding sources that people have for their teamwork. And we've had interesting comments from other areas as well. So the key points we've gathered so far is that the drivers for team science can be necessity. For example, as I said, if you have a rare cancer, you need to have lots of people coming together with the samples and to analyze them. It could be for impact, so there are many groups where it's an advantage to work with others because you have a stronger impact of your research, and it's more efficient. So, for example, if I was asked to do the mathematics on a modelling paper rather than the biology, it wouldn't work very well. It would take me a very long time. But if I ask a mathematician, then they'll be able to do it very quickly. Okay, so the benefits to the researchers that we found from this is that the involvement in novel research, researchers generally like to move forward and think about new things, and so the involvement in this more impactful research can be very interesting. They're acquiring new skills and they're networking, but there are big barriers. People still feel that there's a problem with the single PI culture in that it's always one person who gets the kudos, whereas in fact lots of people have been involved, that you shouldn't just have a first, last, or nothing on publications. Everybody should be acknowledged for the contributions they've made. And that often researchers aren't trained in working in huge teams, so they don't quite know how to engage with all these different people. And of course, university funding structures can be structured around departments that don't facilitate interdisciplinary working. So the kind of issues that are going to be tackling these things are, there's a very nice group of publishers who are working together to work out how to credit everybody on these big publications. We're going to think about how we're going to broaden individual appraisal. So, for example, how employers consider promotions when people have been involved in huge teams, and how funders consider this. And then also the length and magnitude of funding schemes, because if you have a very big team working together, often it takes longer to get to the result, to the impact, than it does if you're just a small team working in one area. So we have to try and persuade the funders to think more broadly about how long you should be funding these big groups. And also to consider how funders want people to show independence and leadership skills, and how we can facilitate people to be able to do this within the big teams to get the opportunities to show leadership and independence. And of course, we've got to build up the team skills, the team working skills of researchers. Okay, that's everything.
And thank you so much. We've got a couple of minutes for questions. Please, Veronica, you just have the microphone.
I don't know whether it's deliberate or, but I feel that what's missing from there is all the work that has gone through the European Union funding, where lots of people have engaged in very big teams. Mm-hmm. And I think sometimes it isn't as efficient as it should be. And I think that's an area that I think Britain actually benefits from EU funding to a very high extent.
Indeed.
I agree, yes, we're definitely looking at EU funding and engaging with EU networks to find out how that works. Often they don't work very well, as you say, and that is a problem, yeah. But the goal is to be a huge team.
And I was slightly concerned that one of the groups you didn't have down, that you were consulting, were people who were concerned with education. Mm-hmm. I think we have to recognise that we're all part of a caste system. We're extremely good in our educational process at actually imprinting attitudes of behaviour which actually make team working much more difficult. And I think we should be trying to get over to people that we have to train people now to recognise that everyone, regardless of research, anyone in medicine is going to have to be part of a team. Mm-hmm. It can only function like this. So I think there's a much bigger dimension, and I would be very worried if we didn't start early enough to try and influence people who are responsible for starting that task.
Well, completely. So the Careers Committee did consider starting with education, but we felt that at the moment that was too broad a remit, and it's definitely on our books to do that in the future, because I completely agree it should be starting in schools and then undergraduate training that people work in huge teams and encouraging them to do that.
Peter Weisberg?
You may have covered this, and I'm sorry if you did, but to what extent are you looking outside traditional biomedical research? Because I think one of the things that REF showed was, particularly disciplines like physics, sometimes the list of authors runs to more pages than the actual manuscript of the science, and they handle it quite adequately by alphabetical lists, and they seem to be able to get their hierarchies worked out around that. So are you engaging with that group?
Yes, so we would really like to get someone for oral evidence from CERN, for example, who can go through how they work in huge teams. If you know any other huge team physicists, then let me know, because that would be really useful. We would really appreciate having them give oral evidence.
Okay.
I noted that you had the APBI on your list. I just want to say that, declare that it were, I don't think that's the most appropriate vehicle for understanding how industrial research is actually done. Mm-hmm. I mean, drug development is one of the examples of big teamwork over many years where actually individuals, in my view, are not adequately recognized. But I think it would be very good to have somebody who is directly involved in that talk to you.
Yes, sorry, I'm really sorry. I forgot to say that Caroline Savage is on our working group, and she is from GSK and is providing that input.
I suspect we could make this the afternoon symposium, but thank you, Anne, very much indeed for that contribution. And that brings us to our third and final policy project showcase, Professor Dorothy Bishop, who's chairing our research reproducibility work. Dorothy.
Thank you. Yes, so this particular thing is a symposium, the Research Reproducibility Symposium that we are planning to run next year. And it's really motivated by the fact that I think nobody in this room can be unaware of the fact that there's been a lot of questions about reliability and reproducibility research growing in recent years, particularly in the general as well as the scientific media over the past 2 years. There's been more retractions of papers, and the industry, the pharmaceutical industry, has been very concerned about failures to replicate so-called landmark papers. So just some examples. This was one of the most influential papers, I think, in this area, which is enormously cited by John Ioannidis, who had this provocative title, Why Most Published Research Findings Are False, in PLOS Medicine in 2005. Subsequently, in Nature, there was a comment about preclinical cancer research and standards in drug development, and again making similar points that the standards were low enough that we couldn't trust and rely on the results that were coming out. In my own field of psychology, this has been quite a hot topic for some years. That again, people love these provocative titles. False positive psychology, undisclosed flexibility in data collection and analysis allows presenting anything as significant. This has had, again, a huge impact with people starting to question our methodologies. The other big impact in this field was this famous dead salmon study, in which a group of people who had taken delivery of a new brain scanner were just testing it out, and they wanted to put something in it in order to just check the parameters. And so they happened to have a salmon. They put it in, and then they ran it through the analytic programs that they were planning to run with people who were reacting to pictures of faces, and found that there were patterns of activity that, with hindsight, one could argue were highly interesting, even though this was a salmon and it was dead. So one does have to worry. This has made it into the general media, not just the scientific media. So in 2013, this time last year, The Economist had a piece about science, problems in science, problems with lack of reproducibility. And of course, this gets us worried that the public understanding of science will be made very cynical if people read these sort of articles and start thinking they can't trust scientists. And this is not just a UK problem, it's international, and this just recently in January, NIH became concerned and started a movement to have plans afoot to try and enhance reproducibility, which is very much what this symposium of the Academy is in its own way also going to try and do. And obviously we'll be taking a lot of information from what's going on in the States as well, but we think we have a distinctive contribution that we can also make. So what we're planning to do, we're going to look at challenges and opportunities for improving reproducibility and reliability of preclinical biomedical research in the UK. We're going to have a meeting that's going to last about 1.5 days, we hope in April or May, with about 60 people from a range of groups. We'll also have international representation. We've already been in contact with science attaches around the globe who've suggested people that we can invite from a range of countries. We'll have some international speakers, and our dissemination will be international. And there hasn't been a meeting of this kind so far in the UK, so this will be the first of its kind, and it will be joint with BBSRC, MRC, and Wellcome. What we aim to do, discuss aspects of basic translational biomedical research that contribute to the problem, so identify what the problems are, but we were very keen in discussions of the steering group that we don't just document the problems, but that we actually try and think of what to do about it and think ahead about ways we might improve matters. So we're going to look at the role of incentives, which is one thing that has been recognised in the literature, the role of training, particularly in methods and statistics, look at what other people are doing, current efforts to improve reproducibility and reliability, and look not just at our own area, but also, as in fact it's a common theme in the other speakers, look at other disciplines, and look at industry, how industry handles these things, and disciplines outside our own. So the topics that we plan to include from industry, we've been looking at people who are concerned with things like quality control, error reporting. For example, in the aviation industry, it's long been recognised that it's a very bad idea to cover up errors. If you find an error, you want a culture where people report it and aren't handicapped by doing so. This is not so true in our science. There's a big move in psychology and in some other disciplines to go for pre-registration of research so that you register your hypotheses and analyses before you do the research. There's also a massive backlash against that. There's a lot of people who are extremely concerned about a negative effect that might have. So that's something we do plan to discuss. Improvements to research design and analysis. There's a sense that a lot of people don't really understand what they're doing with statistics, and things and research design doesn't really quite work if you set it up in the wrong way. And this joke, which some of you may or not be able to read, I can't believe schools are still teaching kids the null hypothesis. I remember reading a big study that conclusively disproved it years ago. So this is a sort of lack of understanding that we think may be about. Another factor that we think could be important is sharing of data. Again, it gets very controversial. A lot of people don't want to do it, but there's a very great move towards open science and making raw data more readily available and analysis packages. So that's one set of topics. And then in addition, the scientific culture. Again, this is small writing, but this cartoon says you're completely free to carry out whatever research you want so long as you come to these conclusions. I think the culture is perhaps not so much, in fact, like that, but more that you have to publish in top journals, you have to publish quickly, and that people are no longer encouraged to do careful work. They're very much under pressure to produce, and this is not good for reproducibility. We're going to examine the role of funders, journals and publishers, and have representatives of those there. And we'll also be looking at how we can do all this but still maintain trust in public in science, in the general public. We did discuss whether we should talk at all about scientific fraud, and it won't be a primary focus of the meeting. We think that a lot of the problems are nothing to do with people deliberately and intentionally being fraudulent, but obviously it may come up as a topic, but it's not what we're mainly after. It's rather practices that lend themselves to reducing reproducibility of science, but which are quite commonplace. So I'll just let you finish by showing you the steering committee and point out that we have a very good mix of expertise on this committee, ranging from animal work, imaging, psychiatry, experimental medicine, representatives of the research councils, people who do wet lab science and so on. So we think we have a good mix here. And the output that we will end up with at the end of the day, we hope by the summer, will be a written report trying to summarise our conclusions and recommendations of what we might be able to do in the academy to improve the situation. And again, it will be focused at a very wide group and written, we hope, in intelligible language for journals and publishers, and as well as researchers, funders and industry. And that's it. Thank you.
Thank you very much, Dorothy. Time for a couple of questions. Is that Rory?
Thank you very much. I'm glad that you're going to focus on the methods rather than the undue focus that's been on fraud, which I agree with you, it's a minority and was clearly what Francis Collins was saying. The names of the people who are on the panel was up for a relatively short period of time, so maybe I didn't see it, but you emphasized the importance of statistics and methodology.
Yes.
If you like, the sorts of things that epidemiologists and clinical trialists do all the time. But I couldn't see any on this panel.
Well, Simon Tavares is on the panel and was talking a lot in our steering group about statistics, and I think has some expertise in that area.
Right. So is that going to be a big focus of the
Yes,
the-
yes. I mean, we are planning to have, we're still drafting the final programme, but we've got quite a well-advanced draft, and there would be a session on this, yes. And we agree it's important. If you have particular suggestions of people that we might include, so this is the steering group, obviously there are in addition a lot of people to be invited, both as speakers and other people taking part, so do let me know.
Good. Back.
I'm interested that you're not going to focus on fraud, because it seems to me that there are three primary reasons for reproducibility of data. That's sloppiness in the first place in its collection, misinterpretation by everybody of the results, and outright fraud. And fraud, I think, despite the efforts of most of our prestigious journals to say that they are just as interested in results from studies that are negative or don't come up with, you know, the wondrous results we were all hoping for, they don't publish them as readily as positive studies. And until we can find some way of actually always finding a route to publish negative results, I think fraud is actually much more prevalent than you'll probably expect to see.
That's a provocative comment, and I think there is a whole spectrum of things that we have to consider. And again, in my field of psychology, this has very much been looked at, and people have tried to survey the relative frequency of things, and they talk a lot about what they call QRPs, questionable research practices. And these are interesting because they are things that people will admit to doing, but which you tend not to do if it's outright fraud. And people will admit to doing things that any statistician or methodologist would make them turn in their grave without realizing that this is not appropriate, because it's become common practice in a lot of labs to do this. So we actually think, certainly in my field, I would say that is considerably more common. For example, another thing known as harking, hypothesizing after results are known. A lot of that goes on, and people regard it as normal. So we think that's probably where the focus should be. But I absolutely agree with you about publication of all results, negative or positive. And I think you may be encouraged to find that there are more journals now that will publish such results. And certainly some of the pre-registration initiatives have taken the view that if you pre-register a study, then they will guarantee, if it passes scrutiny at that stage, to be published regardless of the results. So that's one reason why we want to discuss that particular initiative.
Okay. Take one more question if there is one. Yes, please, gentleman here.
Will your scope include observational epidemiological studies, or is that just too difficult?
I don't think we're going to focus on any one particular type of study. I mean, they may come up. We were going to have sort of examples of problems in different areas in one of our initial sessions. And I don't think we specifically focused on epidemiology. I think we were trying to really identify broad factors that would apply to a number of areas. But again, I mean, do approach me if you think there are particular instances of things that are specific to that area that might otherwise get overlooked.
Thank you very much, Dorothy. I hope you've found that a valuable session. Clearly, three very challenging, complex areas that are being addressed. Let us know how you feel about that. Obviously, if there are specific comments you have, then do address them to the three chairs. That brings this session to a close.